Psychiatric disorders, e.g. depression, anxiety, and impairing psychological conditions, e.g. loneliness, social isolation, stress, are significant problems worldwide. Moreover, for the past decade, rates of these conditions have been increasing among children, adolescents, and adults. Current estimates indicate that approximately half of individuals will experience a diagnosable mental disorder in their lifetime. These disorders impair functioning in everyday life. The physical health consequences of mental disorders raise a related set of challenges because mental impairment increases the likelihood of later physical disease and disability and earlier than expected death. These broad statements fail to convey the endless, poignant stories of individuals who end up unhappy and without jobs, a place to live, and social support. Families often manage, but taking care of individuals with a mental disorder has many challenges and is no substitute for effective treatment. Apart from the personal and family burdens, mental health problems have exorbitant financial costs in terms of lost wages, absenteeism, e.g. from work and school, disability and unemployment payments, and insurance coverage. There are many advances and innovations in addressing mental health problems. During the past several decades, researchers in the mental health professions have developed various forms of psychotherapy, medication, and other treatments, e.g. brain stimulation, for many mental disorders. Depression and anxiety, for example, are the most common psychiatric disorders that people experience. Many interventions are directed at these disorders and have been shown in careful research trials to be effective. The high prevalence of mental health problems and the development of effective interventions suggest a perfect marriage. Perhaps all we need is the equivalent of a matchmaker, some agency or service that connects people to treatment. It sounds simple and obvious. So, what could be the problem? The problem is the harsh reality that is the primary impetus for this book, namely that the majority of individuals in need of mental health services receive no treatment. None. This is true in low, middle, and high-income countries. The reasons individuals do not receive treatment are well known. These include a variety of barriers, such as lack of sufficient services, limited or no insurance coverage, stigma associated with seeking mental health services, and others. Overall, traditional mental health services are not reaching most people in need. There are many efforts in place to remedy this, but their impacts are not at all clear, and more options are needed to improve mental health.